Good evening. We're streaming live. I'm Labor Nellen, traditional naturopath, healer, and whole food expert here at the Natural Health Clinic. And this evening we're going to be talking about autoimmunity and the most common overlooked triggers or situations that can create or at least stop you from being able to naturally help yourself if you are suffering from an autoimmune disease. So once again, thank you very much for joining in. And if you have any questions during the presentation or the class, go ahead and put them in the comment box and I will answer them as either I can get to them or at the end of the presentation. Let me make sure that I am opened up to Facebook, otherwise it's going to be rather hard for me to find your comments and respond to them. Hold on here. Let me get to my face. That should be talking. Oh, there I am. Okay, let me go and click on this. All right, good. I have to turn off the sound, otherwise you can hear the sound through my PC as we're talking. All right, we're all set up, ready to go. So autoimmunity. You know, it seems like the many, even perhaps the majority of patients that I see walking in through the door nowadays has some form of autoimmune diseases. The most common, Hashimoto's certainly very common. Rheumatoid arthritis is very common. Lupus is common. Scleroderma I've run into quite frequently. And there's a whole host of others. Some of them are autoimmune infectious diseases. Those can be quite challenging to work with. But it's interesting that I see so many autoimmune cases. Now, why is that? Well, it's pretty simple. It's because when they go to the orthodox allopathic type of medical practitioner, they're not getting the benefits that they're looking for. Or they just can't tolerate the horrible side effects that many of the medications that their medical practitioners put them on. They just can't tolerate it anymore. Immunosuppressive drugs can be at least quite terrible. But you know, another one that I just came to the top of my mind is like psoriasis. A lot of different kinds of skin disorders I see quite frequently. There are at least 100 plus different autoimmune diseases. Can you believe that? Over 100 autoimmune diseases at least. Now, at its simplest, what is autoimmunity? Well, it's actually your body attacking your own tissue. So, in effect, your body is attacking itself. That's pretty crazy, right? Why would your body want to attack itself? Well, that's one of the things that we're going to be discussing this evening as to what can trigger that and what can set that up. Also, I'll give you a very general and very simple sign of an autoimmune process that might be beginning within your own body. And again, this is very general. If you have some of this signs or symptoms, it doesn't mean that you do have an autoimmune disease, but it could just be a possibility, okay? Not a probability. So there's at least 50 million Americans that have an autoimmune disease. Interestingly, most of them are women. Of course, men can have autoimmune disease as well, but the list that men get is relatively short as compared to the huge, long lists that tend to oppress or affect women. And why is that? Well, we're actually going to be discussing that. That is actually one of the triggers, being a woman. If you're a woman, your body wants to kill yourself. No, I'm kidding. I'm just teasing, of course. But there is a reason that females tend to have more issues, and we will discuss that. So the reason, if you can't really call it a cause, because there's not really one cause to autoimmune diseases. So that's why when you talk to a medical doctor and you ask, well, what's the cause of rheumatoid arthritis or the other 100 plus autoimmune diseases, they'll say, well, there is no known cause. And that's true. There's not one cause. There's many different factors at work. So what we're going to be talking about this evening is simplistic. It's general. The entire subject of immunity is exceptionally complex and would take weeks and weeks, if not many months, to actually thoroughly discuss it. So what we're going to be talking about tonight in this few minutes is just very generalized. I'm trying to boil it down as simply as possible so that you can get an overview understanding of the situation and then what things that you might be able to do in order to help yourself, an action plan, so to speak. So within the immune system, like everything else, it is trying to maintain balance. And there's two main cells. And so when you see up here, this is like a teeter-totter, all right? And so the two main cells that we're looking at, and TH stands for T helper. So we have T helper cell 1 and we have T helper cell 2, okay? So your body, your immune system, is always trying to maintain balance between these two T helper cells. And the fulcrum that the teeter-totter is balancing upon is another immune cell called TH3. And so depending on what happens with the regulation of TH3, one of them can become unbalanced. Well, what could offset or disrupt the regulation of TH3? And those are triggers that we're going to be talking about in just a minute. Now, a person, and especially with women, again, don't mean to harp on you, but it is common with women, and it's also common within pregnancies. That's actually one of the things that can tend to trigger autoimmunity. But during pregnancy, the immune system is naturally compromised, if you will, so that the immune system doesn't attack the new tissue of the fetus. And for women who have had a lot of issues with allergies, especially during their pregnancies, where they found that they tended to become more sick, with colds or flus or sinus infections or whatever the case may be, what they're experiencing is a dominance of one of the either T helper 1 or T helper 2. Okay, so those are the symptoms that imbalances within those helper cells can create. So, for example, if you tend to be more Th1 dominant, you will tend to have an issue with allergies. And there's a lot of people out there that really have issues with allergies. Now, if you read in books for women who are pregnant, for example, like What to Expect When You're Expecting, don't recommend the book. I think it's horrible. There's many better ones. But nonetheless, they talk about, it's really common to have runny noses and sinus drainage and allergies while you're pregnant. Sure, if you have imbalanced Th1 and you tend to be more dominant within that issue. Or what about people that just seem prone more towards upper respiratory infections, sinus infections, colds and flus and things like that? Well, that would mean that they're more Th2 dominant. So again, the body is always constantly trying to regulate and keep these two immune cells within balance through Th3, which is the regulatory cell. So then, what stimulates having the dominance instead of the regulation between the two? Well, the number one answer is diet. For example, who do you know, or have you ever felt yourself, that when you drink coffee, you either feel worse, jittery, more anxiety, or you feel much better? Okay? What you're actually doing is stimulating one of the T helper cells. If you're feeling worse, you're probably stimulating Th2. Coffee is a known Th2 stimulant or trigger. So diet is one of the primary triggers. Of course, here I am, a naturopath, whole food expert, and I'm talking to you about how to help with autoimmune diseases. So you would definitely think that diet might be one of the things that could trigger autoimmune diseases. And it might be one of the ways to correct it as well, right? So what happens in autoimmunity is that once you get one of these imbalances of the T helper 1 or T helper 2, you start having another T helper cell called Th17. Th17, once it becomes active, it starts creating what's called a cytokine cascade. And there's all different kinds of cytokines. I told you it's complex, all right? Just keep up. So there's all kinds of different cytokines, and they create inflammation. One of the worst ones is NF-κB. It's like a stick of dynamite to your tissues, to your body. It creates huge amounts of inflammation within whatever area or whatever tissue it is affecting. So when that happens, that's the trigger for the autoimmune type of response. So when we're working with autoimmunity, we think of what we call the triad effect, or it's like a three-legged stool. So there are three different things that you have to look at and keep in balance, or support, if you will, in order to help with an autoimmune response. And so what are those? Well, the first thing is you look at the genetics. For example, here are things about the MTHF and other types of genetic factors or mutations. And one of the common ones is MTHF, and especially if a woman's taken oral contraceptives and they have felt ill, in fact, to the point that they had to stop taking them, you can be relatively certain that you probably have a methylation issue or MTHF genetic mutation. And you are going to be much more prone, have a far higher than the average population propensity towards autoimmunity. So that's what we mean by genetics. Number one, are you female? Number two, do you have a genetic mutation of some kind? If you start checking all those things off on the list, then you're going to be much, much, much more prone to developing an autoimmune disease. So what does that mean? That means that if you can check off those boxes, then you need to be extremely disciplined and extremely careful if you have not already developed an autoimmune disease to help yourself prevent that type of situation. Let me wet my throat here for a second. This is coffee. I feel better with coffee, okay? All right. So the other things which I've spoken about at length so far are triggers. And there's all different types of triggers, and they are things that we constantly deal with and I work with my patients in order to resolve. The first one being diet. Okay, I already used the example of coffee, how coffee can affect Th2, sugars, grains, especially, not especially wheat, but celiac is well known to be another trigger towards autoimmune disease. In fact, it is an autoimmune disease, if you will. So, grains tend to be major triggers, and what they do is they stimulate Th17 to produce inflammatory cytokines. All right. The other thing that diet can do is it goes into the third leg of the stool, which is affect the gastrointestinal tract, and we'll talk about that in a minute. What are other triggers? Other triggers are estrogen. So if you have higher levels of estrogen, you will tend to have more of a propensity towards developing autoimmunity. So therefore, that's why it's more common with females. Now, unfortunately, men are really having major problems with balanced hormones as well, and many of them are having much higher levels of estrogen. So time will tell if men, over the course of decades, will actually start developing more and more autoimmune diseases. It would certainly stand to reason that that will be the case. Certainly not a good thing. That's also why if you take oral contraceptives, you can be at a much higher risk of developing autoimmune diseases. Actually, if you look at the insert of some oral contraceptives, of some hormone replacements, you'll see on the insert one of the things that it lists as a risk is things like rheumatoid arthritis. Well, what is rheumatoid arthritis? It's an autoimmune disease. It means that trying to prevent a pregnancy or trying to stop your hot flashes could trigger an autoimmune response within your body. So it's something to know and be aware of. Other triggers, and it stands to reason, are infections. Okay, so of course infections would stimulate all this that we're discussing as far as the Th1 and Th2 and Th3 and Th17, etc., because it's the immune system, right? But there are particular infections that will really tend to trigger autoimmune responses, and that is viruses and parasites. And it's interesting that medically speaking, what can be done about viruses? Not a lot. They might give you an antibiotic for a virus, but it's certainly not going to help because antibiotics are successful with bacteria, which viruses are not. And does the medical community at whole or at large even recognize that there's a parasitic situation within the United States or even other industrialized countries? And the answer is no. If you ask that you want to have your feces or stool tested for parasites, they'll ask you, well, have you been out of the country? Because the idea is that if you're in the United States, parasites are not a problem. That's baloney. And by the way, there's 4,000 different types of parasites. And it's a huge issue. And then other triggers are chemical toxicity. All right? And medications fall within that chemical toxicity as well. What are the constant types of exposures that most people have? Well, I have a little list right here. We have lotions. You know, how many lotions do you put on your face and your skin? Hand creams, anti-aging creams, all kinds of different things. And it doesn't matter if they're prescribed or not, over the counter, very expensive or very cheap. They all tend to be quite toxic and affect the system in, ways such as what we're talking about this evening. Not good. Creams, different kinds of plastics. Several times recently I've tested patients as having plastic toxicity, and they're like, oh yeah, I drink lots of water from plastic water bottles and left a whole case of water in my hot car for the last 3 months. I'm kidding, but don't do that. It's really horrible. You actually tend to get concentrated plastic toxins if you have left your water bottles inside of a hot vehicle. So be very careful about that. I am kidding, but there is truth to the jest. Makeup's horrible. It's full of toxicity. I have real issues having ever found any type of makeup long term that doesn't tend to toxify the person. It doesn't matter if they call it 100% pure or bare minerals or whatever. I mean, if you think about it, some of the most toxic substances on Earth, such as heavy metals, are minerals. So, it's just a name. It's a marketing ploy. Toothpastes. Even the natural toothpaste I would be very, very careful of. They're full of toxicity, certainly full of fluoride, and many different kinds of things as well. Of course, there's toxins in fast foods. There's toxins in ultra-processed foods or just processed foods. They're all over the place. Air fresheners, oh my God. Air fresheners are a huge problem, guys. So even these, MLM, multi-level marketing type companies, they say they're all natural. No, there are huge issues with these air fresheners. Plug-ins, sprays, mists that you see. That's more of a commercial thing, but you can hear this mist, especially in restroom areas. Every 5 minutes or 10 minutes it squirts this thing. Those are horrible chemicals, and they will really trigger immune response. If you're in an office, you need to have them removed. Don't have these types of things in your home at all. Don't have them in your car. They're even common in cars now, where you plug them into the cigarette lighter and you freshen your car. It's bad enough to have a new car with new car odor. That's actually formaldehyde. That's an outgassing of VOCs from all the plastics and garbage in your vehicle. And in fact, it's well known with auto detailers that the haze that you notice on the inside of your windows, that's actually from the volatile organic compounds that are outgassing from all the materials in a new vehicle. So it's poison. You're poisoning yourself in a confined area. It's very, very bad. Well, what else as far as, we can just go on all day about chemical triggers, right? It's because it's so common. I mean, we are willingly, voluntarily, and happily toxifying ourselves constantly. Oh, let's buy the $600 cream and make myself look young and beautiful. Who cares if I got an autoimmune disease and in horrible pain for the rest of my life? At least I look beautiful, right? So, it's just ridiculous what's been going on in the world for the last 60 years, 70 years, as far as the chemical experiment that we find ourselves in. Deodorants. Deodorants are full of toxicity. They're also, some of them, full of heavy metals that toxify the lymph nodes and lymphatic system, breast tissue, etc., etc. Water. There are just chemicals in water. Municipal water, city water, if you don't filter it, it is full of toxicity. From petrochemicals to, toxic forms of chromium. You just name it. It's really terrible. Excuse me. Get a frog in my throat when I talk. Don't stop. Maybe that means I should shut up now. So you need to filter your water. A refrigerator filter or a Brita filter, or one of these filters that you screw on top of your sink, kitchen sink faucet. Those are not good enough at all. Not even close to it. They might filter out chlorine, maybe. Chloramines, maybe. Probably not very well, not for very long. But they are not going to get rid of the majority of the chemical toxins that are in that water. So you need to get a reverse osmosis water or a filter. You need to get like a gravity-fed water filter, very high-quality water filter for what you're going to drink and cook with. I do apologize. So you get the idea, however. That is a very brief list of the different types of chemical toxicity that could potentially trigger autoimmune types of diseases. So what about the third leg on our three-legged stool? That is the gastrointestinal tract. And of course, what does most of what we interact with in the world, it seems like, come into contact with first, and that's the GI. Because who doesn't love to eat? People go to places just to eat or just to drink. I mean, it's crazy if you think about it. So what we eat affects the gastrointestinal tract greatly. It creates a situation that you're probably hearing more and more of. It's called leaky gut. It's a permeable gut. So the way that the gastrointestinal system is designed is that it has very tightly wound cells, and in between those cells are junctions to keep them all together. And when we eat a bad diet, which is processed diet, which is inflammatory foods such as grains and sugars, pastas and rice and bread and all kinds of different things, sodas and fruit juices and all kinds of different things. It breaks down those tight junctions so that the cells start coming apart. And so if you have something like this in which there is absolutely no space, and you have things that are keeping or in between those spaces, so that's like mortar within bricks, and then you wear out those tight junctions and now you have space in between those cells, what's going to happen? Well, certainly things could now penetrate through those cells, right? And that's exactly what happens in the case of a leaky gut or in the case of a permeable gut. And what it is food residues. Partially digested, partially metabolized food residues now go through the cells within the gastrointestinal tract and go into the bloodstream. And so what does the body do about that? Obviously, that's a problem, right? You can't have undigested food matter within the blood. That's a serious situation. So what the body does in order to balance that in order to compensate for that, is it creates antibodies. It creates immune cells, of which we've been talking about, right? And so those immune cells, they go and they attack those food residues and destroy them. That's great. We want that situation to happen if we find ourselves in a leaky gut situation to begin with at all. But the problem is that once they've attacked this food residue, these antibodies don't go away, right? They're still floating around in your bloodstream. And so what happens? Well, if they see anything else that's similar to this food residue that they just got done attacking, they're going to latch on and they're going to attack that as well. And then what happens if that cell that looks similar to the food happens to be your thyroid, or happens to be your pancreas, or happens to be a bone cell, or a ligament cell, or a muscle cell, or a brain cell, or a lung cell, or a spinal cell? Well, now you've developed that type of autoimmunity. You see how it works? Or what if it's a nerve cell? Well, now you've developed neurological autoimmunity, MS, etc. Okay? So leaky gut is a serious situation, and it is exceptionally common. You see how many people have autoimmune issues? 50 million plus in the United States? I would say it's 3 times that as far as leaky gut, at least. And I think that's a low estimate. I think it's probably more like 75% of the population within the United States, and I'm not joking. So think about it. Right now there's 50 million plus, 330 million people in the United States. You cut that in half, most of them, because 50% are going to be female, and you have a huge propensity towards autoimmune disease. You already have 50 million people. Assume most of those are women. What's half of 330? Get my point? So there's a huge, huge problem out there. Take leaky gut, permeable gut, bad diet very seriously. Be proactive. You see all the issues with neurological diseases and brain diseases such as dementias and Alzheimer's and Parkinson's becoming more and more common. That's from a leaky gut. It's a very similar situation to what we're talking about now. It just happens to affect, like Parkinson's is more male. It's not autoimmune, but it's going to be a similar situation. So that brings us to, what do we do to fix it? Okay, or at least to help it. What I will tell you is that no matter what, there's not going to be a cure for autoimmune disease. It doesn't really matter if you do the medical approach or the natural health approach or the two combined, there's not a cure. Unfortunately, once these cells over here that we've been talking about are triggered, they tend to stay triggered. What I mean by that is that if you fall off the course, if you're doing something specific and that stops the symptoms that you're having, but then you go back into a situation in which you were doing the things previous that caused this situation, you're going to have a triggered response of the autoimmune system, and it's going to become active again. So once it's triggered, it's very, 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 very easy for it to turn right back on. All right? So first thing is that you need to start working on an anti-inflammatory diet. I've already briefly talked about it. You eliminate the most pro-inflammatory foods because you don't want to stimulate the Th17 to create a cytokine cascade. You don't want to have sticks of dynamite going off within your body and within your tissues. And even if you don't have an autoimmune disease, you don't want that to happen. Okay? You don't want inflammation. So grains, get rid of them. Notice I'm not saying wheat, I'm saying grain. Grain as a category. That means wheat, rice, barley, spelt, corn, oatmeal, all types of grains. All right? Get rid of the grain. Get rid of the sugar. That means all sugars. It doesn't mean a natural sugar. Oh, but it's natural sugar. That means it can't do anything bad in my body because it's natural. No, it doesn't mean that. It's sugar. All right? Get rid of sugar. It doesn't matter if it's fruit sugar, table sugar, honey, coconut sugar, date sugar, palm sugar, coconut palm, see? It doesn't matter if it's beet sugar. It doesn't matter if it is, agave. Get rid of it, okay? It creates a problem, period. So get rid of sugars. Then dampen Th17. So what does that mean? Well, there's different types of supplementation that can help dampen the effects of the Th17 response. All right? Now, what supplements would those be? There's a wide range of possibilities. It doesn't mean just because something is known as dampening that effect doesn't mean it's going to work for your particular biochemistry. All right? That's very important because people try different things. It's like, oh, well, let's help help the inflammation with anti-inflammatory prostaglandins, so I'm going to take fish oils, and that's going to help my joint pain. And they take fish oils and high amounts of it, and it doesn't. The reason is because that didn't work with your particular, your individual, your unique biochemistry. So there's a wide range of different kinds of things that can dampen Th17. So what do? Buy them all, spend a couple of $1,000s on all different supplements, and take each one over the course of the next 3 years and try to figure out which one is going to work? No. You can come into us, we can test you, and within 2 minutes know, and that's a long time, know which one will help you in that particular situation. Third, what do you need to do? Make sure that your body maintains stable blood sugar, stable glucose. How do you do that? Through diet. It will go a long way by eating in an anti-inflammatory type of way. Get rid of the grains, get rid of the sugars. Well, guess what? You're going to have much more stable glucose just doing that. Okay? So it's interesting how all the things start fitting together like puzzle pieces. Get tested for leaky gut. All right? We can do that for you. We can identify if there's a leaky gut situation. If there is, that must be corrected. Must be corrected, or you're not going to get anywhere. And if you keep goofing off a diet and the different things that you're told that you need to keep doing in order to not have the leaky gut, guess what? You're going to keep having huge problems with your joints. You're going to have problems with your thyroid. If it's Hashimoto's, you're going to keep having the same problems. And it doesn't matter if it's a small amount. Get rid of it. Eliminate it. Okay? So what you're doing is you eat less, and okay, so the hole's smaller. Still a damn hole. All right, the hole's smaller in between the tightly wound cells of the gut, but guess what? Still a hole. Doesn't matter the size of the hole. If there's a hole, it's going to create a permeable gut, and they're going to pass through, get into the bloodstream, and stimulate this whole process. Get rid of it. Don't eat the junk. Don't eat the things that you have been found to be sensitive to. All right, here's a big one. All right, and I tell patients this all the time. I test this on patients all the time, and many of them, even though they do many things right, they don't listen to this one. They don't listen. Don't let this be you. For whatever reason, they think they know more. Well, that's fine, but they keep having pain. They keep having the problems with their immune system. So that's great, right? And that is, don't take immune-stimulating supplementation when you have an autoimmune disease. Did you just hear what I said? Don't take immune-stimulating supplements when you have an autoimmune disease. You know what I hear frequently? Oh, I have an autoimmune disease. I need to make my immune system strong. Well, that's ridiculous. The more you fire up your immune system, the more you fire up this entire situation, and the more inflammation and the more problem you're going to have. Oh, well, I'm going to take lots of mushrooms, shiitake, ganoderma, this and that, and all the other kinds of supplements that are going to make my immune system strong. We're going to fight this thing. No, you're going to fire up the immune reaction, and you're going to have a serious inflammatory response. Okay? Don't take immune-stimulating supplementation when you have an autoimmune disease. And lastly, work with a natural health care provider who is aware of this research, aware of how autoimmunity works or doesn't work, however you want to look at it, because there are many out there who says they work with this or that type of situation, but they truly don't understand it. Doesn't mean that you can't get any help, doesn't mean that they're bad people, it just means that they aren't as well versed in it as others who can actually help you with these very complex situations. So functional medicine, there are persons who are really trained well in functional medicine, and they can help you a great deal. All right, and then last, I almost forgot, but I promised you, what could be a first sign of a potential situation that might develop into an autoimmune trigger or response? Have you noticed yourself becoming more and more sensitive to chemicals, chemical toxicity, or fragrances? Have you noticed yourself developing more food sensitivities? Well, that is a situation that could really show that you might be in the very beginning stages of developing an autoimmune response. And another thing, before I forget, I don't know how I could forget, it's quite important. We're talking about the triggers as far as the Th17, and one of the biggest ones, other than what we've already talked about down here as triggers, is actually stress. And it's the type of stress that you're thinking of: stress of job, stress of life, stress of family, stress of world situation, or stress of what's on the television. Stress, demand, having your time constantly blocked. That is extremely stressful, and that in itself, even if everything else is balanced, you're eating perfectly, you're not taking in toxic chemicals or medications, your GI tract is intact, is in perfect function, everything else is perfect. If you have certain amounts of stress to the levels that are going to trigger a response within your body, you're going to have that situation. You're going to have a Th17 trigger, cytokine cascade, inflammation, autoimmune response. Okay? So the other thing that you have to do within the action plan is deal with emotional stress, deal with your response to emotional and stressful situations. Otherwise, that as well, you will not be able to really help yourself with autoimmune situations. Okay, so let's look at if there are any... Uh-oh, I seem to have frozen myself. Huh. Well, I don't know if it's still working. Let's see. Yeah, sometimes if it freezes, it still will be there. Okay, well, not sure if you saw everything. If you have any questions as you're reviewing the video, go ahead and leave them in the comment box, and I will go ahead and answer them as I'm notified. Oh, thank you. Angela says still working. Okay. Yeah, sometimes, depending on how the broadband is streaming, it will actually freeze within Facebook, but then it hasn't been lost. So if you go back and view the video, you'll be able to view the entire video. So kind of strange how technology works sometimes. It has a lot to do with live streaming, but it does look like it is still functioning. Okay, so if you have an autoimmune disease, what you can do is you can schedule an initial consultation with us, and what that is for me to review your entire history, do examination and different testing, and see if we can help you or not. If we can, then we will create a treatment plan just for you and what will work for your particular biochemistry and your particular situation. Now, typically that initial consultation is $249. We spend a lot of time with you. We listen to you, which, depending on your character, is worth $249. No, I'm kidding. Is unusual, right? Who listens to you anymore? So usually it's $249. Well, if you are referred to us through our patients, then we actually knock off $100, so it's $149, okay? Better. However, if you respond, and what I will do is put the links here in just a moment. If you respond and click on the link that is with this video and you schedule online, you will be able to get an initial consultation for only $62. So that's $187 off. All right, and you can schedule for either of our two locations. That will be Houston or here in Victoria. And if you do that by 11:59 p.m. this evening, you click on the special link, or if I don't have a special link, I will have a link, but you may have to enter a code. You just enter whatever that code is, and you will get $187 off at checkout. So you'll get that initial consultation for only $60, but you got to hurry. It is truly only till 11:59 p.m. this evening. All right. Well, I believe that is it for this evening. Thank you for tuning in. Again, if you have any questions in the future as you're reviewing this video, just leave them in the comment box and I will get to them as I'm notified of them. Thanks a lot for watching, and I hope this information helped you.